So again, this presentation is for educational purposes. It's not a substitute for medical advice, diagnosis, or treatment, and listeners should seek the advice of their medical professional advisors if any questions should arise. The objective of this presentation is to identify precautions for exercising during and post-pregnancy, explain the fourth trimester, list safer exercises that might be performed through the trimesters, state what to expect during the postpartum recovery, and lastly, increase your knowledge of proper body mechanics, especially when caring for baby. Now, we have to keep in mind, everyone's path to, through, and following pregnancy will be different. Therefore, approaching exercise is going to vary per individual. In reference to exercise and fertility planning, in general, the research shows that regular exercise can be beneficial for the most part. Exercise helps with weight control and can also help with fertility, but weight loss should not be the only goal. There needs to be a focus on being healthy in general. Appropriate exercise, good nutrition, sleeping well, managing stress, and certainly avoiding constipation. All different variables that are going to help you reduce inflammation. Now, there are some considerations which need to be kept in mind. One is that during IVF, there is a rare risk of ovarian torsion where the ovaries could twist and affect the blood supply. You need to clear with your doctor their guidelines for exercise during time of retrieval. In addition, you may need to avoid certain exercises that would be jarring or quick body motion changes such as twisting, flipping, or inverting, and that includes yoga. And lastly, you want to speak with your doctor as to how you can keep moving during that time with a modified routine. So pregnancy hormones affect multiple body systems, the cardiorespiratory, reproduction, urinary, skin, neurologic, and also musculoskeletal. The musculoskeletal effects are going to be the primary focus of this presentation. You all know the body changes in pregnancy. Weight gain shifts your center of gravity backwards. Core muscles stretch and weaken. Extra weight causes greater stress to the joints and additional work for your core muscles. There's also joint laxity because of the hormone relaxin that's produced during the pregnancy. And also, all of these changes can lead to back pain, pelvic girdle pain, incontinence, or diastasis. And diastasis is when there's a separation of the abdominal muscles. But don't let that scare you, because after pregnancy, it does tend to resolve for the most part. And if it doesn't, you certainly need to address that with your physician. There are many benefits of prenatal exercise, including improving overall fitness, reduced orthopedic issues and pain, potentially less excess maternal weight gain. Prenatal exercising has also helped to show improvements with gestational diabetes, reduce risk for preeclampsia, which is when blood pressure elevates and there's a cascade of other physical effects. It may also decrease the need for C-section and may also facilitate a faster postpartum recovery. In addition, elevation of mood because of the endorphins on board occurs from exercise, as well as it can help you increase concentration and focus, reduce stress, and possibly improve sleep as well. So the benefits usually do outweigh the risks, but it's really important to know our precautions and contraindications for exercising in pregnancy. That might include if you have vaginal bleeding, abdominal pain, regular painful contractions, shortness of breath with exertion, any dizziness, headaches, chest pain, muscle weakness affecting your balance, and also calf pain or swelling. But in general, you want to start only after you obtain clearance from your OB or your other obstetric-related provider to rule out that there would be any medical reasons for you to avoid exercising. Pregnancies without complications should include aerobic exercise and resistance training. For the aerobic exercise, it's recommended walking, swimming, stationary bike, low impact dancing, 150 minutes total, spread throughout the week at a moderate intensity, which would also be the equivalent of what we call the talk test, meaning you should be able to have a conversation with the person next to you to make sure that you're not straining yourself and overdoing your activities. For resistance training, it's recommended to perform 2 days a week, but you want to make sure that your muscles work harder than usual, because it's when you work your muscles to fatigue and then they rest that they become stronger muscles. The other factor with resistance training is it's important to go ahead and avoid Valsalva, which is when you hold your breath and bear down. So other considerations with exercise is that it must be individualized, especially for those with obstetric and other medical issues. However, before you start, you must get medical clearance. Other considerations would be if you are obese, really overweight, it's recommended to lower the intensity and shorten the time of your exercises. So instead of doing a 20-minute walk, you might do a 5 or 10-minute walk and go from there. On the other extreme, if you are using higher intensity, if you're used to exercises at a very high intensity, it's really safe, usually for most of the pregnancy. You want to make sure that you stay well hydrated and you avoid overexerting yourself. And the other consideration is if you do participate in certain activities, you want to avoid contact sports like a martial arts or other activities like an ice skating, any things that would challenge your balance and put yourself in jeopardy. So that brings us to the fourth trimester, which is the first 12 weeks after giving birth. Even with the easiest pregnancy and delivery, free of complications, your body still needs time to recover. Postpartum recovery can be affected by various things: pain, breastfeeding difficulties, fatigue, lack of sleep, stress, emotional disorders, and incontinence, to name a few. The American College of Obstetricians and Gynecologists recommend for exercise in the postpartum period that exercises can be resumed gradually after pregnancy as long as medically safe, and also depending on the mode of delivery and the presence or absence of any medical or surgical complications. For vaginal births, you want to obtain medical clearance to start exercising. If you've had an episiotomy with incision or tears, they should be healed. There should be no bloody discharge, and you need to respect the perennial discomfort if there's any swelling or any pain. For C-section births, it may take an extra 4 to 8 weeks longer to recover. There may be greater pain with initial moving around, deep breathing, and coughing, and baby care can be more challenging. Another consideration is breastfeeding. As you progress past the pregnancy, caloric consumption becomes an issue because breastfeeding burns the calories. You have to make sure you have adequate amount of caloric consumption on board. You want to make sure you wear supportive bra and properly fitted clothing and shoes. And as you progress post-pregnancy and your activity levels increase further, depending on your exercise activities, you may want to pump before you do your exercising. So the benefits of postpartum exercise are many. Weight loss helps you relearn how to use your body, helps with the postpartum depression and general well-being, and also improves overall fitness. But you need to be mindful. Healing is important, sleep is important, and you must ease into the activities. So for example, if you have a day where the baby's up and you're not sleeping and you're under a lot more stress, for those days you might want to tailor your activities a little bit. And then the following day when you're feeling a little better, you progress back into it. Just listen to your body. There are some postpartum warning signs not to exercise, and follow up with your physician, and they can include on the list dizziness, nausea, fainting, any unusual shortness of breath, fever, extreme fatigue, redness, warmth, or painful breaths, redness, warmth, tenderness, or pain in the arm or leg, any severe pain, and also any urinary or bowel issues, meaning you're unable to initiate, any pain, leaking, or loss of control. So I divided the postpartum exercise components into 5 different variables. I'll be explaining each one in detail, from core fitness, cardiorespiratory aerobic exercises, strength training, flexibility, and lastly, but not most importantly, body mechanics, ergonomics, and baby care. So when I say core fitness, I'm talking about the core muscles, which consists of a muscular drum with the diaphragm on the top, the abdominal muscles in the front, the pelvic floor muscles on the bottom, and the back muscles in the back. One of the reasons I put up this visual is I want you to understand that the diaphragm moves in coordination with the pelvic floor. So if you inhale and fill up your lungs, the diaphragm actually goes down and the pelvic floor will also go down as well. And then when you exhale, they both recoil back up. So postpartum week 0 to 2, priority should be on rest, recovery, and baby care. When ready and without complications, you want to start the basic core. So the basic core is your diaphragmatic breathing, gentle pelvic floor contractions, and then coordinating the breath with the pelvic floor. For diaphragmatic breathing, I usually start my patients lying down in a comfortable position, but it can certainly be done in a variety of positions. You want to inhale through the nose, let the breath go as deep as possibly can toward the feet, which means your belly's going to expand a little bit. Your rib cage might also expand. And then you go ahead and exhale. Not only is diaphragmatic breathing good, but it also helps to calm the sympathetic nervous system. So it is wonderful to use as a stress management tool. And it's something that doesn't take too much effort. For the pelvic floor contractions, the pelvic floor consists of 3 layers of muscles that form a muscular hammock or sling. The function is to support, pee, poop, and sexual function. The pelvic floor muscles help balance your intra-abdominal pressure. Now, the movement, some people know it as a Kegel, is basically a lifting up and in of the pelvic floor muscles. Now, a lot of people think with a Kegel, they just squeeze tight, but it's not just a squeeze, it's a lifting up and in. Another error that I see a lot is that people just tense up their abdominals and squeeze their pelvic floor, and that pushes your abdominals out. And you don't want that. Again, I have to reiterate, it's a lifting up and in. So what I do for a lot of my patients is I usually start off with a blueberry pickup cue. Again, that doesn't always work for everyone, but I'm going to share that with you today. What I do is I tell my patients, pretend you have a blueberry at the vaginal opening and you want to grab it and lift it up towards your belly button. And usually with that cue, I'm able to elicit a little bit more of a pelvic floor isolation, which is what I'm working toward. I don't want the buttocks squeezing. I don't want the thighs tightening, just want a pure isolation of the pelvic floor muscles. And this is something that can be done pretty early on postpartum, but again, starting gently with control. So postpartum weeks 2 to 6, when you're ready, you want to introduce short bouts of walking, which means you'd start with around 5 to 10 minutes and slowly progress up to 20 minutes. If you are feeling well and without symptoms, meaning no fatigue, no pelvic floor discomfort, and no bleeding, you can introduce some light basic exercises, which would include gentle stretches as well as light body weight exercises. Remember to coordinate the breath with exhaling and a gentle pelvic floor contraction on exertion with the movement. And you want to always avoid Valsalva, holding your breath and bearing down. So gentle stretches might include stretching the hip, the hamstrings and the back of the leg, the hip flexors and the front of the hip, and then also chest stretch, opening up the pectorals at the door. These are selected mainly because it helps correct some of the postural changes that occur during pregnancy. It's really important when you stretch, though, that you have very gentle, happy stretches. You don't want to push yourself to that end range. For the body weight exercises to get started, the first one is the abdominal brace. I highlighted it because it is really the foundation for all the other exercises. It helps hold in the muscles and give you more support. So beyond the abdominal brace, the heel slides would be done with the abdominal brace first, and breathing, of course, not holding your breath. Same thing with bridging. A lot of people make the mistake when they go bridging and they lift their hips up as high as they can to the ceiling, and then they hang on their ligaments of their lumbar spine, when instead you want to do the abdominal brace and then with control, lift up only as far as you can keep maintaining the abdominal brace in a comfortable range. Okay, additional exercises include the cat-camel on the hands and knees. And then another one I recommend is just doing a standing partial squat as you are comfortable, because you're going to have to bend your knees and squat in order to do some of your childcare and eventually all of your body mechanic activities. For weeks 6 to 12, you must receive physician clearance first to start formally exercising. Once you're cleared, you want to progress the aerobic exercises, and then if without contraindications, introduce light formal strengthening program. You'd continue with your light happy stretches, and you'd also want to use proper lifting and body mechanics, especially with baby care. For the aerobic activity, talked earlier about moderate activity. This is a perceived rating of exertion that just shows where the moderate activity would fall. You basically would feel like you can exercise for longer periods of time and able to talk and hold a short conversation. You'd want to do non-impact activities such as walking, swimming, or dancing. You'd start with 10 to 15 minutes and assess the effects. And then you want to progress time slowly. And if there are any negative responses, you'd certainly want to cut back. Some daily activities in childcare may be enough activity to start. So please keep that in mind. So next we have strength training. You need to build up strength for baby care. It's important to learn and follow proper form. It's recommended to start with one set of 10 to 12 reps at a comfortable but challenging weight 2 times weekly. For the resistance, you have a choice. You can use your body weight, bands, light weights, machines, or get creative with home equipment. And just remember, you want to exhale on the resistance and do not hold your breath. Your flexibility training, again, helps with posture, and you must make sure that you have happy stretches. And now we go into basic baby care body mechanics. You want to stand close to the baby when lifting, hold the baby close to your body when carrying, distribute your weight evenly on both feet, and balance the baby's weight in the center of your body, not on the side. When you're bending and lifting, use your legs and hip hinge, and try to avoid bending over and twisting from your back. Here's a sample. You want to carry the baby midline and not on one hip. Changing table. The best table height for parents would be directly in front of and slightly below the elbows. All diaper and changing materials should be within arm's reach. You want to stand close to the table. And if the table is too low, think about bending your knees and not bending over from the back. For squatting and lifting the baby, you want to stand close to the baby, feet shoulder width apart, one foot slightly in front of the other. You want to squat down or kneel, bending the knees with a straight back, picking up the baby and bringing him or her close to your body. Keep the back straight and push through your legs to stand up. Also, you might want to think about exhaling and tightening the abs and the pelvic floor as you lift. For lifting a car seat, it's important for you to know you don't want to lift the car seat before 6 weeks postpartum, and first check with your doctor for clearance. Standing close to the car seat on one side with your back straight, bending the knees and squatting down to grab the car seat, you want to hold it close to your body. Standing up, same thing, push through your legs, exhale, tightening the abdominals and the pelvic floor as you lift to put less stress on the pelvic floor. You also want to keep in mind there's a need to continue using good body mechanics just with you alone, getting in and out of bed, lifting the baby in and out of the crib, lifting the baby to and from the stroller or the floor. When you're getting up from the floor, giving the baby a bath, doing laundry, breastfeeding, and everything else with your daily activities. Because if you can use good body mechanics, you will protect your spine and you will protect your pelvic floor. So, final words of wisdom. First and foremost, as a new mom, you need rest and recovery. You want to watch your posture using good strategies for lifting, moving, and being more comfortable. You want to make sure you hydrate and eat well. Another factor is you want to avoid constipation. Do not hold your breath, blow as you go, and gradually progress your activities if there are no leaks, no pressure feelings, and if you are pain-free. Now, normal urinating would be voiding 6 to 8 times in a 24-hour period. Leaking when laughing, coughing, sneezing is not normal. Leaking with exercise is not normal and may be a sign that you're doing too much, too fast, and too soon. If you have any issues with incontinence, pelvic or low back pain interfering with taking care of yourself and baby, please speak with your physician regarding a prescription and referral to a pelvic health physical therapist. Getting evaluated by a pelvic PT to determine what's going on with your pelvic floor muscles can help. They'll look at your posture, they'll look at your movement, they'll look at your strength overall, and also your pelvic floor muscle strength. Then they'll determine what muscles are weak, what muscles are tight, and how the proper muscles and movement strategies can be recruited so we can facilitate the healing process, which is really individual per person. Please ask for help if you feel overwhelmed. Do you have any questions?
Thank you so much for this, Dr. Smith. This was absolutely wonderful. I love the detail, but also it was just very clear in layman's terms. And it was a lot of information that it wasn't overwhelming. Very clear to follow. So thank you so much for this. We do want to encourage all of our viewers to join Dr. Smith if you have a few minutes at the Memorial Expo booth so that she can chat with you there if you have any private questions or any additional questions you may have for her about her presentation or about Memorial in general. We do have, and again, we do apologize that we started behind schedule, but we do have another presenter from Memorial, Dr. Esker, who will be starting right after this. So you will get to hear more from Memorial in reference to neonatal care. So Dr. Smith, we thank you. Thank you so much. This was absolutely wonderful. And as I said, for our viewers, you can meet Dr. Smith or some of the other team from Memorial at the Expo booth, or you can jump right over. We're going to go to our next session with Dr. Christian Esker.
Thank you.
You are so welcome. Take care.
Take care.